Hi everybody, my name is Lilian Momina. I'm a clinical nutritionist and welcome to my YouTube channel. Today I want us to discuss about hypertension, high blood pressure, what it means, how to manage it, how to control it, the risk factors and all that, all these factors. I'll try to be as... What is hypertension? Hypertension is basically a raised or elevated blood pressure. It is measured through two parameters. We have the systolic that measures the pressures in the arteries when the heart beats, and you have the diastolic, the lower one, that measures the pressure between the beats, the arterial pressure between the heartbeats. And there are several factors that predispose someone to this condition. We have one, there is the age. The older you get, the more you are at risk of getting blood pressure. From 35 years old, both male and female, they are at risk of getting high blood pressure. But currently, with the increasing pressure, societal pressures, bad dietary habits and all this, we are getting people younger getting hypertension. We'll discuss about that. We also have obesity and overweight. Of course, when you're overweight, the blood volume demand increases. So this, of course, increases the pressure in your arteries to pump more. So definitely there's a raised blood pressure. And also when you're smoking, when you're drinking alcohol, when you're doing drugs, definitely increase your heart rate, and this increases the blood pressure. We also have high stress levels like work pressure, societal pressures, family pressure, all this. They increase cortisol. Cortisol increases blood pressure too. We have things like maybe genetic factors that will predispose you to pressure, like maybe if you have a family history of blood pressure, your mom, your dad, your brother, your sister, then you are at a higher risk. For blood pressure, we have the primary and the secondary causes. The primary causes is basically the normal life cause, because of maybe the normal functioning, the normal activities here and there. Then there's the secondary factors that bring about hypertension, like maybe you're doing medication or you're doing drugs. The normal painkiller, mara moja, Panadol, these ones here and there, they increase your risk of blood pressure. Also the drugs, the caffeine, the smoking, the alcohol, all this, and these chronic infections here and there, they will predispose you to that. And also you being diabetic. When you're diabetic, it is a comorbid. More than 80% of people who are diabetic end up developing hypertension. So when you're diabetic, you need to be making sure that you put in key measures to prevent the occurrence of blood pressure. So someone is considered to be hypertensive if their blood pressure goes beyond 140 systolic and 90 diastolic. And then there's also the pre-hypertensive stage. That is anything that is beyond 120/80. Unfortunately, Kenyans do not do medical checkups so well, but monitoring your blood pressure can be as simple as going to the pharmacy. Even the chemists nowadays, they have the blood pressure machines, and you go and get checked. It's not even more than 200 bob. If you've assessed yourself and you've seen that you're at risk of getting hypertension, you can also get the blood pressure monitoring machine. It is available, it is all over. And then you also make sure that you get your medical checkups every now and then. You go for an assessment, you go for a checkup every once in a while if you are at risk of getting all this. But anyone who is alive, provided you're growing and you're above 25, you are at risk of developing hypertension. So if you go for checkups and your blood pressure is above 140/90 2 times, and you are considered hypertensive, considering on how well or how bad you perform, you might be on hypertensive drugs. So what are some of the complications that are associated with being hypertensive? One, of course, there is reduced lifespan, and then you're also predisposing yourself to cardiovascular diseases and premature death. You can also get vision loss. You can have early dementia. You get that you're forgetting things. Sometimes you might even be young and you're like, nowadays I forget things a lot. That can be a sign of you having hypertension. But in most cases, hypertensive is asymptomatic. That the only way that you will identify if you are developing hypertension is getting frequent checkups. That is the only way. That is the only sure way. Because by the time you start getting maybe kidney failure, the time you start getting the congestive heart failure, the time you start having dementia, the time you start having poor vision and all that, your BP is already at a very, very high rate. It is already risky. So you need to control it before it gets to there. The time you're having those dizzy spells, the severe migraines and headaches and all that. So what are some of the dietary approaches that you can use to reduce or stop hypertension? The main one that we usually see and people think it's a joke is controlling sodium. Sodium, chumvi ya kawaida, the table salt. Sodium has several functions in the body. It is an essential ion that is needed by the normal functioning of the blood to maintain balance and all that. But again, an elevated sodium level increases water retention in the body, and then water retention in the body increases the blood pressure, because sodium is supposed to be regulated so that it can allow proper functioning of the kidneys. When the blood sodium is high, the body will retain water. When the body is retaining water, you can get edema. There's of course the elevated blood pressure, then you also risk getting kidney disease. So controlling sodium is very, very important. Reducing table salt. When you're eating, make sure that your food, you see, there are people who love chumvi kali. That is not good for you. It is bad for you. The dietary requirement for salt is usually 2300 milligrams per day. That is less than a tablespoon of salt a day, inclusive of everything, the table salt, the processed foods, all those. Sodium that is occurring naturally, as you've said, your body still needs some sodium for normal functioning. So the sodium that is occurring naturally, maybe in fruits, in vegetables, may not be an issue so much. So you can leave that out and take the vegetables, take the fruits. You can blanch. You can maybe you can peel some of the fruits that are rich in sodium, and then this will reduce the sodium content in the fruit, or maybe the blanching in the vegetables. The blanching is basically taking the vegetables, dipping them in hot water and removing immediately before they start dissociation of the water-soluble nutrients. So that is blanching. Then you cook them, and then you cook them well. Then you don't add salt, because you're trying to control the sodium intake. So we want to control the table salt, or the additional salt that you are taking up. So another way that you can control sodium is also reducing on processed foods, sausages, ham, all this, like the canned food, because you see, the longer the shelf life of a food, the less nutritious it is. In essence, that it will have more sodium. All preservatives have sodium, and it will have less fiber. So you see, we want to avoid and control the intake of all this processed food. And then the next one is controlling sugar. You need to control sugar. Why am I talking about controlling sugar? Because fructose has been linked to elevated blood pressure in almost all studies that are measuring the metabolic syndromes. Fructose is only metabolized in the liver. So in the liver, there's a lot of the dissociation aspect, because the body cannot utilize fructose. So there's a lot of dissociation, and then all this, there's a lot of blood needs and all that, and this causes pressure. So you want to control sugar as much as you can. If you can avoid sugar, the added fructose, the table sugar, the sweetened juices, the sweetened drinks, all this, the sweetened breads, the sweetened cakes, the sweetened anything that you taste and it's sweet from your supermarket, you should do away with them. The sweets, the Kinder Joys, all these are bad for your health. Most people with high blood pressure or at risk of blood pressure are obese or are overweight. So controlling intake of sugar, and then also prioritizing intake of complex carbohydrates as opposed to refined and processed carbohydrates will help you control your weight. You will have more fiber in your diet. Fiber is great for your gut. When your gut is functioning well, your body is able to metabolize your nutrients better. The next one is prioritizing whole foods. When you're doing your meal planning and you are hypertensive or you are at risk of hypertension, you need to make sure that your carbohydrate source are from whole foods, your protein source are whole foods, your fat source are whole foods. Make sure that you're taking in whole meals. Let's say you want to do ugali, you can do ugali ya kusiaga. You want to do rice, you can do brown rice. You want to do chapati, you can do brown chapati. You want to do breads, you can bake your own breads in your house. Try as much as you can to cook foods in their natural state. So siaga unga ugali, chemsha mchele yako, chukua waru yako, tengeneza nduma here and there. Those are carbohydrates. Then your vegetables, do vegetables in plenty. Vegetables are great for you. They're a great source of potassium. Of course, we also have sodium in these vegetables. But again, the good thing with the naturally occurring sodium, it will not affect you so much unless you're critically ill. So you need to make sure that you take in these vegetables in good amounts. Of course, you can choose from an array of vegetables that are not so rich in sodium. Maybe something like cabbage here and there, carrots, cucumbers here and there. Green vegetables are okay, but again, some are said to do have high sodium levels. So if your BP is a serious concern, you can blanch these vegetables to reduce the sodium components in it. Then you cook your vegetables well. Then avoid adding salt when you're cooking foods. You can do tomatoes. They are a great source of vitamin C. They are a great source of flavonoids, carotenoids, and all that. Make sure that you do your vegetables in variety. In Kenya, we pride ourselves with diversity in terms of vegetables, in terms of foods. Let's utilize them. You've controlled your sodium, you've controlled your sugar. Now we increase your potassium. Potassium is important because it improves kidney functions. Taking in foods that are rich in potassium are great. Again, potassium, the best foods, we have the green leafy vegetables and the fruits. We have avocado. Avocado is a great source of potassium. We have ndizi, bananas. All this. We have also nuts, the great source of potassium. And then the next thing after that is also you're controlling your protein. You're controlling your protein because hypertension has a direct link to kidney and sometimes liver failure. So you don't want to overload your kidney. When you take excess protein and you need, what happens to the rest? It is converted into glucose and stored as fat. In the process of conversion, there's a lot of release of ammonia, and you see the ammonia is toxic, so the liver again is tasked with converting that ammonia into a less toxic component, that is urea, then it is again supposed to be excreted by the kidneys. So you see, you're giving again your liver and kidneys extra work. You want to make sure that you control your protein to moderate intake as much as you can. A portion of meat, not like nyama quarter, like a quarter of nyama quarter is enough for you in a meal serving. You can also alternate the proteins. We do both the plant and the animal proteins, because the plant proteins are also source of other macronutrients which we want to make sure like that we take in. We have the magnesium, we have the potassium, we have the proteins. Again, don't overdo any of those, because you see with plant proteins, again, there's reduced bioavailability, there's reduced digestibility. So you don't want to overdo them, because again, you'll overwork your system. So you also don't want to do the animal protein, because you see again, they are bioavailable, they are digestibility, so that you can get a very spiked level of protein. So you want to control and make sure that you combine this, alternate the plant and the animal protein, so that you can get the most out of this. The other aspect that you can work with when you're doing a diet that is going to reduce hypertension is controlling metabolic stressors. Controlling metabolic stressors is basically controlling anything that spikes cortisol. If you're in a stressful situation, be it relationship, be it workplace, try and get assistance for like maybe breathing techniques, those ones. Maybe pray. If you're spiritual, you can pray. If not, you can talk to someone. You can share with a friend here and there. Don't allow stress to finish you. Then, you can do natural remedies or natural herbs. Natural remedies, of course, there is wheatgrass. Wheatgrass is great. It is rich in fiber. It is rich in phytonutrients. It is rich in minerals, vitamins, and chlorophyll. Wheatgrass is very good with controlling blood pressure, blood sugar, and you can also do moringa. You can also do chia seeds. The next one is controlling your cholesterol, controlling your bad fats. Of course, even the good fats you're going to control. Let fat not exceed 30%. Prioritize sources of healthy fats. So healthy fats, we have fish oils, omegas, they are good sources, chicken, nuts. So even cholesterol, you make sure that you control intake of foods that are rich in cholesterol. When you're doing your meats, make sure they're lean, reduce the fat, cut the fatty area. Vegetable oils, do it controlled. If you have hypertension, please reduce fried foods. You can bake. It's better. You can bake your potatoes if you want something like fries. You're craving for fries, you can bake them. Then you can marinate, just so you're not deep frying those potatoes. So the amount of fat they're going to absorb and you're going to take in is less. Reduce fat as much as you can, because cholesterol and high triglyceride levels have a direct relationship with hypertension, and this has a direct relationship with heart failure, heart diseases. So you don't want to get to there, because again, managing complications associated with the hypertension is worse, and it is harder than preventing those complications. Then we have the last one, physical exercise. Exercise is great because it improves mood. Then it is a great way of controlling weight, reducing obesity. It also improves digestion, and you can also sleep better. People who exercise sleep better than people who don't, and it also improves your activity during the day. So in productivity and all that, your brain cells are active, so you can be able to solve more work problems, more family problems, more societal and relationship problems. Just take it easy, breathe in, breathe out, and monitor your blood pressure every now and then. If you have blood pressure, also you can have your blood sugars checked here and there. You can do a liver function test, a kidney function test here and there every once in a while to prevent and avoid complications, and also to make sure that you arrest the condition before it gets to us. Also, you can talk to your dietitian, a registered dietitian. They do for you an individualized meal plan. Let's say if you someone who's like maybe with a BMI of maybe 35, 38, and they have hypertension, the energy requirement is above maybe 3,000 kilocalories per day. So maybe you can work the dietitian towards reducing this intake from 3,300 kilocalories per day to maybe 2,600 kilocalories per day. Also, make sure that anything that you start, you don't do it drastically, because you already have complications, and work towards reducing this from 3,300 to 2,600. Be gradual and take it easy on yourself. You can add the natural spices. You can add black pepper, you can add ginger, you can add garlic, you can add dhania, you can add pili-pili, the normal pili-pili, lekali, you can add hoho here and there. This improves food taste, so you don't have to do so much. So you reduce your salt intake too, as you're working towards reducing your kilocalories intake a day. So if you are maybe borderline, you are overweight, borderline obese, maybe 25 to maybe 30, that is your BMI, and you have hypertension, you can work with your dietitian towards getting from maybe your intake is maybe roughly maybe 2,500 to maybe 3,000. So you can work with your dietitian towards getting from the 2,500 kilocalories per day to around 1,600, so that you see when you're working towards reducing your energy intakes per day, you're also working towards reducing your weight. So there is a direct link with reduced weight and reduced blood pressure. So make sure that you work towards this, and let's live a healthy life. And we also have water intake. You need to make sure that you're still hydrating well. If you have hypertension, if your blood pressure is high, then you need to make sure that you reduce further this water intake or this fluid intake that you've calculated with 2 glasses less. This is because when your blood pressure is high, there is more water retention in the system. Again, talk to your dietitian, have a sit down with them, let them understand your daily practices, how much water you're taking in, how much chai, how much tea you're taking in, how much soup, how much sodas, and all that. And then you want to do away with any sugary drinks. Avoid. We are hypertensive, so you're going to control fluids. So we don't want anything to do with sugars here. So we are going to do clean water. If it's tea, let's do green tea, let's do your wheatgrass, let's do these things that are going to promote your health. Let's do chia seeds here and there, but let's avoid sodas, let's avoid sugar with milk, sweetened milk. No, we are going to do away with them. So make sure that let's control the fluids, let's control the diet, let's do physical exercise, and let's control the hypertension. Thank you for listening, and yeah, stick around, you'll definitely learn more. If you've not subscribed, kindly do so, and thank you for watching. Bye.